New metrics released by the Oregon Health Authority changed the way county risk tiers were determined just last week. Now, some public health officials are discussing evaluating those metrics again. NBC5's Jenna King spoke to experts in Jackson and Josephine County. She has our top story tonight at 6.
Grace, Josephine County Public Health tells me the current metrics aren't suitable for measuring individual county risk levels. They're asking for metrics to be based on county level data instead of state.
We are seeing the hospitalizations going up. It is a worrisome sign.
A steady increase in COVID-19 hospitalizations and cases continues to bring concern to local health officials. Jackson County says it's seen a 17% increase in the number of cases per week.
If you do the math, we've had about an increase of a third more cases in just 2 weeks.
Under the state's new metrics, county risk levels include statewide COVID-19 hospitalizations. If there are 300 COVID hospitalizations and a 15% increase over a 7-day period, then counties whose data places them in extreme will go to that category. If the state's hospital numbers aren't that bad, counties that qualify for extreme will stay at high.
Because the goal of the metrics is to measure our risk level, and when we're measuring statewide, that doesn't necessarily encapsulate the risk that we do or do not face.
Josephine County Public Health Director Michael Weber says the county is seeing over a 7% positivity rate. The county's public health department is discussing having county-level vaccination rates as a new metric and utilizing regional hospitalization rates instead of statewide.
Our metric is really based off of what the numbers do in the large metropolitan areas. So if they have a small shift in their hospitalization rates, it could have a big effect on us.
Weber says the current metric isn't a good indicator of how individual counties are doing, and that a shift in the metric would also hold counties more accountable.
It puts the control in the county's hands. If the county is able to effectively get vaccinations out in the community, and if the community accepts them and gets vaccinated, we can actually track our progress and we can point towards an effective way that we can have an impact.
Weber says nothing has been finalized, just talks of potential changes. Live in studio, Jenna King, NBC5 News.